And if you look for the countries which made progress in healthcare, these countries have health as a top policy and strategy agenda for the country, not for the Ministry of Health. Because a number of the determinants that are affecting at the end health system contributes less than 20% to the life longevity, although we have all this information about life years gained. So I think the message is health is opportunity. I think for Croatia it's a huge, if we would apply Michael Porter's approach about competitiveness, maybe the biggest financial problem of Croatian government might be the best opportunity if we can change the mindset and the frame. The next group was about, do we know what we do? It's about relevancy of data, about tools and instruments we use for, let's say, hopefully one time having governmental policy, not only ministry's policy. And this was by Valérie Morin, our Irish lady who looks like a French lady and has a name as a Belgian. She was presenting data from OECD, and we cannot make decisions without reliable data. And we have huge problem in the country about the data, I must say. And that was then below this level of analysis. It was Peter Drummond who was showing how we can use good data to manage policies. And then Mr. Finn Christensen, who was showing how health technology assessment works as a practical tool using good data to make good decisions. Below this line, we had Professor Stavljanić, who was showing some very valuable data, and health policy makers should immediately take the best and the worst messages from this research and make a concrete plan how to solve it. Because if the hospital infections are such a huge problem, then you know what is your priority. And also, I think it's important that public knows what is in this research, not only professor knows what is, because there is no help of something what lies in the box. At that level, we had also Sinisha Varga, who was presenting, I think, for the first time, someone who is making decision and knowing the differences between behavior of doctors, of local, of regional, of clinical hospitals, variations in efficiency, in volumes, and so on. And that's the really first step to start acting to make the policy at least equal and equally accessible to anyone. The next group is, I would call it, innovation group, which was this one. The messages we got from Lichtenberg is actually the same we got from the previous groups. Now, everything is measurable. We are actually living from Sumerian times on in the civilization of figures, numbers, and measurability. And we should not close our eyes if we know that there are data which are proving one or other thing. So basically, because then we know where to put the money. What Boris Azaïs said is brave, but I think it's true. Health systems are the least effective systems. In US, you have $1,700 billion running around. And maybe example of best efficiency and best inefficiency in the world at the same time, depending on what you look at. And many health systems around the world are really what Boris said, examples of low efficiency and effectiveness. One of the solutions is definitely integration of work inside the system between the patients and the doctors. I was a week ago at Harvard. They had fantastic presentation they are testing interaction between patient and physician. So they put two persons on the monitoring while there is a therapeutical process going on. So they measure brain activity, heart activity, blood pressure, and everything to see is there connection or not between the one who is curing and the one who is receiving cure. And it's really fantastic to watch what you see on the physiological level. Some of them are really flying like birds together. Some are not connected at all. But connection is, and connectivity is a crucial, I think, for the world and for the solution, because we have to integrate all the players. I just finished reading the book Good Thinking, what they say, and I think what is important for the health systems is I don't believe in reforms. And I think I may say it because I was personally 4 years working under this brand. It's like empty box of gasoline, they would say in postmodern metaphors. No one is making changes without pressure. And everything what happened in the history was made under the pressure. Evolutionary, economic, scientific, competition or whatever. And believing that someone can make changes based on the rational or ethical decision that they will change it, I simply don't believe it. It's strong change in my thinking. I think there is a need for competition and competitiveness, what is not the same. And without competition and competitiveness, what means equal role for all players which are delivering services in health, in education. I don't care if my kid is treated by a state doctor or private physician, private teacher, or for my tax money. I need the best services, best physician for the money I pay. And I think it's important for the country that this also becomes an important agenda. We heard two representatives of embassies, and I think at the end we heard two ministers with two strategies, one in health, the other one is social sector and employment and pensions. I hope that they were listening equally carefully as we do, and politicians know that they are listening carefully. And what Professor Vukičević said about innovators, there is and I would end with this, there is a big study made by behavioral psychologists. There were 200 great innovators, many of them Nobel Prize winners, participating in the study. The question was, what is the profile of innovator? And they came to a very consistent psychological, family and social model of what kind of people can make great new things. It's very interesting to read, because as anything else, even this is not by chance. What type of family, what type of education, what type of freedom, what type of personal wealth in the family is the standard what makes people great in thinking. I believe it's individuals at the end which are really making innovations. You cannot order a genius, you can only support the genius, and systems should be designed to support the genius, not to kill it. Thank you very much. I think it was a fantastic conference, and we had the really honor to host leading people from the world in Croatia. That's, I think, also important for the country. Thank you. Oprostite, u 8 sati je ova kazališna skupina, u 8 kažu.